Hello everyone and welcome to Blood and Hematology YouTube channel. Normal and abnormal morphology of platelets are discussed in this video. Platelet morphology varies in various congenital and acquired disorders, and gives major diagnostic clues in thrombocytopenia and platelet function disorders. Normal platelets are small, non-nucleate, disc-shaped cell fragments, derived from megakaryocyte cytoplasm. In blood smears made from EDTA-anticoagulated blood, platelets appear as round to oval, with smooth outline, measuring about 1.5 to 3 micrometers in diameter, with a pale blue cytoplasm and fine, purple-stained granules. Platelet granules may be dispersed throughout the cytoplasm or concentrated in the center. The central granule containing cytoplasm is known as the granulomere, and the peripheral, colorless or weakly basophilic zone that does not contain granules is known as the hyalomere. Activated platelets are transformed platelets from smooth, inactive discs into spherical shapes with multiple pseudopodia, filopodia, or spiky projections, due to activation or in blood smears made from capillary blood. Platelet dysmorphism refers to abnormal platelet size, shape or internal structure seen on a peripheral blood smear, which indicates defective platelet production or maturation and reflects bone marrow disorders. Large platelets are round to irregular and larger than normal but smaller than red blood cells. They represent young newly released platelets and indicate increased platelet turnover. Large platelets suggest peripheral platelet destruction rather than bone marrow failure. They are seen in immune thrombocytopenic purpura, recovery phase after marrow suppression, myeloproliferative disorders, and inflammatory states. Giant platelets are abnormally large platelets that are equal to or larger than a normal red blood cell. They usually represent very young immature platelets and are seen in acquired or inherited conditions. Giant platelets from a 21-year-old man with immune thrombocytopenia purpura. Giant platelet with gigantic granulomere and vacuolated hyalomere from an 87-year-old man with primary myelofibrosis. Giant platelet with unequally pale basophilic hyalomere from a 61-year-old woman with primary myelofibrosis. Small platelets are round to oval and much smaller than normal platelets. They reflect decreased platelet production and a bone marrow production defect. Platelets with reduced or absent cytoplasmic granules, giving a pale or empty appearance, indicate a defect in platelet granule formation. They are seen in myelodysplastic syndrome, acute leukemia, chemotherapy-related marrow damage, gray platelet syndrome, and congenital platelet function disorders. Platelet anisocytosis refers to significant and abnormal variation in platelet size and the presence of small, normal-sized and large or giant platelets on a peripheral blood smear. It indicates platelet production failure or increased turnover and bone marrow stress or disease, and often is associated with platelet function abnormalities. Platelet anisocytosis is seen in immune thrombocytopenic purpura, myelodysplastic syndromes, myeloproliferative neoplasms, recovery phase after bone marrow suppression, and severe infections or inflammatory states. Platelet anisocytosis, giant platelet, granulation anomalies and 2 hyperchromic platelets in a patient with myelodysplastic syndrome. Platelet dysplasia and a mass formed of numerous platelets, heterogeneous in size, shape and morphology in a patient with acute myeloid leukemia. Platelet dysmorphism and giant platelets with basophilic hyalomere and cytoplasmic blebs in a patient with acute myeloid leukemia. A giant platelet has a large granulomere and bizarre shape. Gray platelets are platelets that appear pale gray on peripheral blood smear due to absence or severe deficiency of alpha granules. They are classically associated with gray platelet syndrome, a rare inherited platelet disorder. Thank you for watching this video. If you liked this video, to give it a thumbs up and share it. Do not forget to subscribe to the channel, if you still have not. You can click on the bell to receive notifications whenever a new video is uploaded.